Hello everyone, my name is Dr. Saša. I'm head vet at Aura Veterinary Center, and
My name is Sophia. I am the head veterinary nurse at Aura Veterinary Center.
today's topic is weight management, which is one of the most common problems issues in daily clinical practice. Same like in human world, obesity is
That's
becoming really more and more, unfortunately, problem.
Yeah.
So is in the pets. What we can do about this problem?
Yeah. So, like you said, it's really common, and it's something that nurses are usually the ones to see it first because the pet family or pet owner comes into the clinic. We get the pet up onto the scales. If it's a dog, obviously, if it's a cat, we'll need to bring them into a consult room. But we can see straight away, oh, maybe this dog is a little bit overweight, maybe they're a little bit underweight. So it can start with a nurse consultation, or it can start when you see the pet as well. But from a nurse perspective, we usually like to get the animal onto the scales and then take them in and carry out a body condition score. So this is something that we can do. We can combine the weight of the animal and the body condition score. So basically what we see on the scales is not the full picture. So we have the weight, fine, but then we need to actually physically touch the dog and the cat.
Sorry, one really important thing I can see, at least from my side, is that pet family members, they are frequently getting false picture solely relying only on the scale.
For sure.
So that's
Yeah, and that is one really big issue as well, because you could have a Labrador that is 30 kilos and you could have a Labrador that's 22 kilos. The one that's 28 could actually be a perfect weight, and the one that's 22 may not. And if you go onto Google, you can see the different perfect weight for a Labrador, but every patient is different. So it's really important that we can actually physically assess the animal. So what we look at is the ribs is the first thing. So we feel along the ribs. We want to be able to feel the ribs, but not see them. Also, when we look from above, we can look down on the animal and hopefully see a nice visible waist. And then we want a nice tummy tuck as well. So I have these little pictures here as well, just to show everyone what I'm referring to. So this is a body condition system. So it's from 1 to 9, but basically you can see the animal here is too thin, the ideal weight, and too heavy. So when we're carrying out our body condition score, we can basically say there are 3 out of 9 or 5 out of 9, and it's a really good way for us to track and monitor the progression of the animal. So that's the dog version there, but there is also the cat version as well. So really easy, and it's good visual, so you can actually see where your cat is on the system. Pretty helpful.
I know that pet family members, they love to see the chubby pet, but we have to maintain proper healthy weight ratio. So it's very important point that vet nurses, they are playing really pivotal and important role in the clinical practice. So can you just tell us from your point of view what to say to the pet family, what to look after from the start at their home, what to observe, what to do, and okay.
Usually for me personally, I always start with asking what they're feeding and how much they're feeding, because I tend to hear a lot, I'm giving 1 cup in the morning and 1 cup in the evening. And I don't know how many calories are in those cups, but I can bet it's not accurate and it's not the amount. So it's really good if I can find out how much exactly, and then I can work out how much that pet can get. There's nothing necessarily wrong with the cup. It's just sometimes the amount of calories in that cup might be too much or too little for that pet. So again, it's not a one size fits all. So I do like to find out what they're eating, what's their routine, are they exercising, not exercising, are they able to exercise, do they want to exercise? Because as well, we can see sometimes overweight animals, they become quiet in themselves and they don't want to go for their walk and they don't want to interact as much. So it's just kind of picking up on the behavioral science, the routines, what they're eating, everything like that as well, you know?
But also there's a moment which we can take inside, is that this is hot climate area, and the hot period of the time, hot ground makes a problem. So
it's really tough. I think that is definitely a battle that people have here, because there's a big part of the year where you can't get out as much as you would want to with your pet.
Yeah,
so that I think that is really tough. So again, that's why it's so important that people are feeding the correct amount of food per day and not giving too many treats, whether that's human food or dog treats, cat treats, whatever it is, because as well, human food, you know yourself, like carrots, for example, are quite high in sugar. People seem to think like, oh, I'll give loads of carrots, but that's actually contributing to the weight gain in some cases as well. So
carefully.
Yeah, it is. It's something they have to be really mindful. So there's all these little tricks and stuff like that to be mindful of.
Also, there are some within the breeds. There are some differences. So some breeds they are more prone to the obesity and so on.
Yeah. I would say Labradors is the first one that comes to my head, and maybe British Shorthair from the cat breeds. What do you think? Did you?
Okay, but not only solely, but definitely.
For examples, yeah.
And that's also the problem. For example, what I've seen is for example, if you have British Shorthair, by default they have problem with the joints. And if they get over, and then that's more or. Different boxers or something.
Of course. It can lead down a road of other issues, heart disease, joint disease, all these other issues. So I think as well that's something great that if people can come in, do a nurse consultation, we can pick up on issues sooner. So okay, I might see a dog that's really, really overweight, but maybe there's also a joint issue there. So it means that I can let you know sooner and involve you quicker on a pet that might have other underlying issues, or not even, it's not just overweight, it's the underweight animals as well. They've 16 kilos 2 months ago and now they're 14 kilos. What's going on there? That's something that we should definitely highlight and obviously alert you straight away, because underlying issues as well could be a factor.
For me, personally, really, and we stand together with that, it's prevention. Preventative, the screenings, checkups, blood checkups, body condition score checkups. This is really pivotal role about this problem. What do you recommend? We touched it already about diet, but how do you recommend pet family members to do the dieting?
Okay. So once I know what they're feeding, how much they're feeding, I guess we can kind of go from there, whether it's a change of diet completely onto a weight management diet, or if it's just adjusting the food that they're currently on. It depends, but it's really a team effort between the pet family and the clinic to support and help people, because it can be very overwhelming if you're told, okay, your pet needs to lose 2 kilos. It's like, oh God, that can be quite overwhelming. So it's like something we can do gradually, introduce it gradually, especially if it's a new diet. We don't want to change them quickly. We want to do, from 7 to 10 days, a gradual changeover, so we don't cause any stomach issues and stuff like that. So really, I guess from the team's perspective, we need to follow up. We need to do regular weigh-ins, even phone calls, checkups on WhatsApp. It doesn't have to be in person every time, but it would be nice to see the animal once a month at least, so I can physically see how it's doing, in case we need to alter the plan or change anything, really.
So this is, you already touched this, so I would like to wrap this topic now. In summary, kind of brief guidance, what we could recommend pet family members for their pets, what they should do in brief, 1, 2, 3, 4.
Okay, well first I think book in for a nurse consult is number one. Even if you're not sure if there's an issue, or if maybe you're like, oh, is my pet a little underweight, overweight? If you're not sure, just come in. There's no harm coming in. And we can check, we can help with feeding plans, routine plans, and just general support or advice. And then if we pick up on something, we can basically send them your way and you can deal with everything else. That's what I think.
Okay, lovely. Okay, folks, that was all for this topic today. Please give us comments, suggestions, any possible questions. We'll be more than happy to answer to those questions. Thank you.